The non-invasive blood pressure monitor is another helpful tool that can be used to automatically measure the blood pressure of an adult or pediatric patient. To use the NIBP monitor, power on the monitor and adjust the contrast if necessary. Select the appropriate size blood pressure cuff and apply it snugly to the patient's extremity. The exact position of the cuff is not important because the cuff provided by Physio does not have a bladder and inflates completely around the extremity. Connect the tubing to the cuff and connect to the NIBP tubing connector on the monitor by pushing the connector straight in until a snap is heard. Before taking the first blood pressure measurement, change the initial cuff inflation pressure if necessary. The initial cuff inflation pressure should be set to 30 millimeters of mercury higher than the patient's systolic pressure. The factory default for the initial inflation pressure is 160 millimeters of mercury. After a first reading, the NIBP monitor automatically adjusts the inflation pressure to be about 30 millimeters of mercury higher than the patient's systolic pressure. If you know the patient's blood pressure and need to adjust the inflation pressure, select the NIBP area on the screen. Select initial pressure and choose the appropriate inflation pressure. Be sure not to select an inflation pressure that is below the patient's systolic pressure. Doing so may cause the NIBP monitor to reinflate and take longer to obtain a reading. This could also be very uncomfortable for the patient. Position the patient's arm in a relaxed and supported position at about the same level as the patient's heart. Tell the patient that the cuff will inflate and cause a big squeeze around the arm and that his or her fingers may tingle. Advise the patient not to move their arm during the measurement because it could make it even more uncomfortable. Press NIBP to start a measurement. The NIBP area shows the increase in pressure as the cuff is inflating. When the inflation pressure is reached, the cuff slowly deflates and the blood pressure measurement is obtained. Be sure the patient's arm is not moving during the deflation cycle. Arm movement will interfere with the measurement and cause the NIBP monitor to reinflate and take longer to obtain a reading. This can become very uncomfortable for the patient. The blood pressure is shown here in millimeters of mercury. Blood pressure may also be configured for measurement in kilopascals. The top number is the systolic pressure, the bottom number is the diastolic pressure, and the smaller number to the left is the mean pressure. An NIBP measurement can be stopped and the cuff deflated at any time by pressing the NIBP button again or by disconnecting the cuff or tubing. Dashed lines appear in the NIBP area, indicating that the last measurement was interrupted. The monitor can be set to automatically measure blood pressure at a recurring interval, such as every 10 minutes. Automatic intervals can be pre-configured or selected during use. To set an interval while monitoring a patient, use the selector to highlight and select the NIBP area. The NIBP overlay appears. Select interval. The available intervals are displayed from 2 to 60 minutes. Highlight the interval that is desired. Select Start or press NIBP to initiate a blood pressure measurement. After the blood pressure measurement is obtained, the timer is displayed next to the systolic pressure. The timer counts down, indicating the minutes remaining until the next NIBP measurement. The LifePak 12 NIBP monitor has built-in messages to help troubleshoot problems that may arise. NIBP check cuff indicates the tubing is not connected to the cuff or the monitor or is kinked. Reconnect the tubing and repeat the NIBP measurement. NIBP motion may occur when the NIBP monitor detects the patient is moving continuously during the deflation. Remember to advise the patient when a blood pressure measurement is going to occur and to keep the arm relaxed. For more information about troubleshooting, messages, and suggested corrective actions, consult your operating instruction manual. This concludes the non-invasive blood pressure monitoring section of this